Good morning, guys. So today's lecture is on heart failure. I want this session to be more interactive. Can I have some ideas from you? Imran, what do you think heart failure is?
Ma'am, heart failure. There used to be this girl in school now. We used to be friends.
Kritika, can I have ideas from you?
Is it a blockage in the heart?
Can you please repeat it?
Ma'am, is it a blockage in the heart?
Okay, that's myocardial infarction. That will be done later. Anyone else?
Ma'am, from what I know, it's a condition of heart where it doesn't pump blood as it should.
Perfect. Let's dive deeper into every aspect of heart failure. This should be an interesting class.
Pathogenesis of congestive heart failure occurs due to injury of the cardiac muscle. Injury of the cardiac muscle occurs due to decreased ejection fraction, preserved ejection fraction, pulmonary heart disease, and high output states. Injury to heart muscle causes a loss of function of cardiac myocytes, which decreases the ability of myocardium to generate force. This renders the contractility of the cardiac muscle and decreases stroke volume, thus resulting in a decreased cardiac output. To compensate for the decreased cardiac output, carotid baroreceptor response and activation of RAA system take place. In the carotid baroreceptor response, increased activity of sympathetic nervous system cause increase in heart rate and positive effects on ionotrophy, thus causing vasoconstriction and increased BP. Activation of RAA system causes release of renin, causing conversion of angiotensinogen to angiotensin 1 and 2, creating fluid retention. Ultimately, both these responses lead to worsening of left ventricular function, which in turn leads to heart failure.
Heart failure etiology. Heart failure can either be systolic heart failure or diastolic heart failure, which leads to blood in the lung and further congestion. Left-sided heart failure. It can be systolic or diastolic. Systolic. Systolic can be caused by ischemic heart disease, long-standing hypertension, and dilated cardiomyopathy. Diastolic. It can be caused by conditions which cause concentric hypertrophy or restrictive cardiomyopathy. Right-sided heart failure, which is often caused by left-sided heart failure, which can either be because of isolated right heart failure or chronic lung disease.
Now we can say about the morphology of heart failure. In gross changes, as you can see in this picture, ventricular muscle are hypertrophied, which leads to weak pumping action. Heart chambers are dilated, sometimes massively leads to mitral insufficiency. Left atrial enlargement is also seen, which increases the incidence of atrial fibrillation. In microscopic changes, it is non-specific, consists primarily of myocyte hypertrophy with interstitial fibrosis of areal severity, as you can see in this picture.
Now let's see the different types of heart failure. There are three types: left, right, and biventricular heart failure. Left-sided heart failure is characterized by a reduction in left ventricular output and an increase in left atrial and pulmonary pressure. The organs affected are kidney and lungs. In lungs, the gross appearance is wet, bloggy, and edematous. Microscopy shows appearance of heart failure cells along with hemosiderin-laden macrophages, while stained with pearl stain. The causes of left-sided heart failure include rapid increase in left atrial pressure and pulmonary edema, which causes mitral stenosis with reflex pulmonary vasoconstriction. Coming to right-sided heart failure, it's characterized by a reduction in right ventricular output and an increase in right atrial and systemic venous pressure. The most common cause is left heart failure. Isolated heart failure of the right heart is characterized by chronic lung disease, pulmonary embolism, and pulmonary stenosis. The organs affected are liver, in which congestive hepatomegaly leads to nutmeg liver, and in spleen, congestive splenomegaly leads to gamma-Gandhi bodies. It consists of calcium, fibrosis, and hemosideриnuria. Biventricular heart failure is where both sides of the heart are affected. The common causes are ischemic heart disease and cardiac myopathy.
Now we are going to see the pharmacotherapy of heart failure. The treatment is based on two types: acute congestive heart failure and chronic congestive heart failure. First, we're going to look at acute CHF, that is decompensated. The aim of treatment of acute CHF is decreasing the fluid, that is diuretics, and increasing the pumping, that is inotrophs. Drugs used for acute CHF and for diuretics is loop diuretics, common site of both, and difference. For inotrophics, we have B1 agonist. Next, for chronic congestive heart failure, we have compensated method, which for aim of treatment is decreasing the work, decreasing the fluid, decreasing the LVH, and inotrophic action. Drugs used in chronic CHF and decreasing work is vasodilators. Vasodilators can be differentiated into three main categories given below. And decreasing the LVH, cardiac remodeling, these drugs can decrease the mortality. Beta blockers such as carvedilol, metoprolol, and bisoprolol. ACE inhibitors, enalapril, decrease mortality in CHF, and angiotensin receptors blockers, telmisartan, decrease mortality in CHF, and aldosterone antagonist, spironolactone, and eplerenone.
Now let's look at the recent drugs for congestive heart failure. First, we have BNP, which is brain natriuretic peptide.
It causes natriuresis, which is a reduction of sodium in the body, and causes vasodilation. Under BNP, it includes nesotide, which is recombinant BNP. It is not given orally and is given intravenously. It is short-acting and used for acute congestive heart failure. NEP inhibitors. They are effective orally. Examples include sacubitril and ecodotril. Next, you have vasopeptidase inhibitors. It is also effective orally. Inhibits both ACE and NEP. Examples include omapatrolate and sampatrolate. Side effects include cough and angioedema. Next, you have angiotensin receptor blocker and NEP inhibitor. The L-varsatin drug is a angiotensin receptor blocker, whereas the sacubitril is an NEP inhibitor. Secondly, you have vasopressin receptor antagonists. Vaptans cause an increase in urination and vasodilation. So under Vaptans, you have conivaptan, which is given intravenously, and tolvaptan, which is given orally. The next drug is levosimendan, which is an ionotropic drug, which acts by sensitizing myocardial troponin C to calcium, as well as by inhibiting PDE3. An open ATP-sensitive potassium channel in smooth muscles to cause vasodilation. The side effects include hypertension. Sacubitril valsartan combination drug therapy. Orally active neprilysin inhibitor, which prevents the degradation of ANP and BNP and other vasodilator peptides. It is also used in combination with ARB valsartan and is used in advanced heart failure.
Now let's talk about how to prevent heart failure. 1. Blood pressure control. High blood pressure is a major risk factor for heart failure. Managing blood pressure through lifestyle changes, such as reducing salt intake, maintaining a healthy weight, and taking prescribed medication can significantly reduce the risk. 2. Diabetes management. Individuals with diabetes have an increased risk of heart failure. Controlling blood sugar levels through medication, diet, and exercise can help prevent complications, including heart failure. 3. Cholesterol management. High levels of cholesterol contribute to the development of arteriosclerosis, which can lead to heart failure. 4. Regular checkups. Regular medical checkups allow for early detection and management of risk factors for heart failure, such as hypertension, diabetes, and obesity. 5. Avoid smoking and limit alcohol intake. Smoking damages blood vessels and increases the risk of heart failure. 6. Control stress. Chronic stress can contribute to heart disease. 7. Lifestyle modifications. Adapting a healthy lifestyle is crucial in preventing heart failure. This includes regular physical activity, maintaining a balanced diet, low in saturated fats, cholesterol, and sodium. 8. Regular exercise. Engaging in regular exercise helps maintain a healthy weight, strengthens the heart muscle, and improves overall cardiovascular health.